Surge in new coronavirus cases has seen South Africa break records with 26,000 cases reported on Saturday alone. Sunday's numbers were much lower, partly due to a decreased testing on that day. If you look at the test positivity rate, though, it tells a different story. It's at 30%, meaning that essentially about 1 in every 3 people are possibly testing positive for the coronavirus, so almost round about that figure. Meanwhile, almost 14,000 people have been hospitalized and more than 63,000 have succumbed to the virus. Let's put these figures in perspective. Bring in Associate Professor Penny Moore. She's with Wits University, as well as the National Institute for Communicable Diseases. Prof, thanks for making time for us. It's great to have you on the program. So, until this point, one would imagine that modeling had given us an idea of when we would peak for this wave of the pandemic. I wonder, though, whether the gatherings we've seen take place over the weekend gone by could change that data.
I think it's very difficult to predict what's going to happen. The arrival of Delta in our country has rather changed the whole perspective of this pandemic in South Africa. So Delta, the new variant that has been described across much of the world now, is probably responsible for almost all the infections now that we're seeing in South Africa. And it's much, much more transmissible than either Beta, which was responsible for the second wave, or the original variant that caused the first wave in South Africa. So we're essentially having to rethink what we know about how quickly this virus spreads. And I think it's really important for people to understand this virus is much, much more transmissible. What that means is that we have to be much, much more careful about wearing our masks and sanitizing. We have to essentially take all these non-pharmaceutical interventions even more seriously than we were asked to do in the second wave.
Are we able to tell as yet how far we are from the peak?
I don't think we're able to tell that at this stage, no.
Wow. Many people, of course, are relying on vaccination to try to give them a level of liberty. But there's also what we've called breakthrough infections, right? Essentially, people who are vaccinated still contracting the virus. How much of that do we know is actually taking place in South Africa?
There are breakthrough infections happening, and breakthrough infections happen in the context of every vaccine for SARS-CoV-2 and for every other vaccine that's been developed over the years. No vaccine is perfect. The vaccines that we have in South Africa are effective against the original variant. They took a knock against Beta. But against Delta, we have substantial data that now suggests that the vaccines that we are using in South Africa should be effective against the variant that we have circulating currently in South Africa. But they're not perfect. All vaccines will occasionally allow, despite the fact that you aren't vaccinated, you will see people who become infected. Sometimes that's because it's fairly early on and people who have been vaccinated haven't yet had time for their immune systems to develop responses. But even after substantial time and giving your immune system all the time it needs, you will occasionally get breakthrough infections.
Right. In a context where those breakthrough infections take place than are expected, we can't also rule out, I presume, the possibility of having more variants, because what we've been told until this point is if the virus can spread, there's an opportunity for it to continue to mutate, and in that context, more variants could very well be on the cards.
I think, I think that we need to understand that this virus changes, and not just this virus, all viruses change. At the moment, we have huge levels of infection in South Africa. We have not yet managed to bring that down, and not just in South Africa, in many parts of the world. And every infection comes with the risk that the virus will mutate. This is what viruses do. They come in, they infect us, they deal with our immune responses, which are good. Even to SARS-CoV-2, we develop good immune responses. And in fact, that's why the virus is changing. It evolves to incorporate mutations that try to make it less visible to the immune system. So as we continue to have high levels of infection, I think it's certain that new variants will emerge. The virus is constantly trading off how fast it can spread with how well it can dodge the immune system. And so we will see constantly new variants emerge. Whether those variants come to dominate, whether they become a public health problem is a different matter. Delta has become a public health problem. There are many other variants that have emerged that don't quite have the strengths that Delta has, and so have not become a public health problem.
I don't mean to be alarmist, but are we essentially in a situation where we could get a variant that's able to, call it, surpass the current candidates of vaccines we have? And I'm talking across the globe now. And what does that actually mean? In my mind, we'll have to start from scratch.
I think that's unlikely. I think what we are learning is that if we can boost the immune system high, then our immune system is able to deal with variants. So, for example, the Pfizer vaccine that many people in this country are receiving, it triggers very, very high levels of antibodies in our bodies. And if we can trigger such high levels of antibodies, generally they're able to deal with the variants relatively well. They take a knock, there's no denying it. They take a knock against the variant, but they still are able in most cases to neutralize that variant. And what that means is that our antibodies are able to bind to the virus and stop it infecting our cells. So I think what we may be looking at is the reality may be that we need to constantly boost our immune systems. At the moment, the existing data that we have suggests that the vaccines that we have in South Africa are likely to be efficient in dealing with Delta. But in the future, certainly, I think that we may be looking at a situation similar to flu, where we may be looking at coming in every year with a slightly different, perhaps slightly different vaccine. And the idea is to boost those antibodies right back up to nice high levels again, where they are able to deal with the variants.
Professor Penny Moore, great speaking to you. Thanks very much indeed for making time. Professor Moore is an associate professor at Wits University and is also with the National Institute for Communicable Diseases.